I'm Commissioner Christian Leinbach, and I want to welcome you to another Berks County Commissioners Weekly Update. And the topic this week is COVID-19 and its impact on the opioid and overdose crisis in Berks County. We're broadcasting live via Microsoft Teams live event and also on BCTV and Facebook and YouTube live. At this time, I'd like to recognize Commissioner Barnhart's Executive Assistant, Jessica Blauser.
Comments or questions must be germane to the topic being discussed and include your full name and municipality where you reside. If you are from the media, please put your name and who you are with. Non-media participants, please limit your questions and comments to one per person.
Thank you very much. I want to welcome everyone to this program. It's an important topic. Our colleague, Commissioner Barnhart, Vice Chair of our board, has been extremely active with SOS Berks, the Council on Chemical Abuse, and is going to be leading this program, and it's important. Many of you may remember that last spring, as we were really in the throes of the first COVID surge, we did discuss concerns relative to the impact on people with really in two categories: mental health issues and people dealing with a variety of addictions. And it was predicted then that this would have a negative impact on our residents in those categories. And unfortunately, that prediction was true. We're going to hear more about that today from a great panel. I want to thank Commissioner Barnhart and Jess Blauser for pulling together the great group of people we're going to hear from. And a little bit later, I'm going to allow Commissioner Barnhart to introduce those panelists. At this time, I'd like to recognize my other colleague, Commissioner Michael Rivera, for some opening comments.
Yes, Commissioner Leinbach, thank you very much, and welcome everyone who is viewing this weekly update. This is a very important topic that we're going to be discussing today, so I want to thank the panelists that are here today. I know most of them here, except one or two, so thank you for being here. I know the information that you're going to share is very important and very valuable to our community. So I'm looking forward to hear the information that you have here. Thank you for being on our show.
Thank you, Commissioner. I would say I know all of them except for this John Adams guy. I read a book about him by David McCullough, but I thought he was dead already. I'm not sure. No, this is a great panel. I know every one of these folks, and they are each experts in their field. And again, I want to acknowledge Commissioner Kevin Barnhart. Kevin has done some great work with SOS Berks, and it's absolutely appropriate that he's facilitating this panel today. With that, I'll turn it over to my friend and colleague, Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach and Commissioner Rivera, for the intros. Appreciate it very much. We have an esteemed panel here today, again, to discuss the impact that COVID-19 has had on opioid and overdose crisis in Berks County. We have leading off Stanley Papademetrio, our Executive Director of the Council on Chemical Abuse. We have John Adams, our Berks County District Attorney. John Hollenbach, our Acting Berks County Coroner. Dr. Bill Santoro, Chief of the Division of Addiction Medicine at Tower Health. And Yvonne Stroman, Community Program Specialist, Council on Chemical Abuse. Just an intro, we've been engaged as SOS Berks for nearly 6 years. We've been meeting the first Monday of every month, with the exception of July and December. We were meeting in Alvernia for a number of years, but now we've been meeting virtually on a monthly basis. We have strong support from the community. We have very strong support from University of Pittsburgh, Peru, who guides us and helps us through our processes, as well as the innovative techniques happening in the Commonwealth and across the country, as well as finding grant sources for us. We are broken into 6 groups. We have prevention and education, treatment and healthcare, community outreach, public safety, data collection, and the editorial board. And twice a year we put out the Response magazine, which is a tremendous magazine. We've also gone online with the magazine to help people to find resources for prevention, treatment, and recovery. So with that little intro, again, we have our group here, and they're going to do a wonderful job of guiding us through some of this information we need to know about. The number that we received from our coroner, the end of 2020 has been confirmed. We had 130 related overdose deaths in Berks County, which unfortunately is the highest number we've had. So we need to continue to strive moving forward and really make some critical changes in our community. So I want to turn this over to Stan Papademetrio, who will start out with our panel and the first series of questions. Thank you, Stan. I think you're muted. Stan?
Okay. Sorry about that.
That's okay.
It's not a virtual meeting for me unless I keep myself muted for a little bit. So
it's live TV.
Yes. Thank you, Commissioner Barnhart, and as well as thank you, Commissioner Leinbach and Commissioner Rivera, for the invitation here today. It's been with COVID, it's been some time since we've really been able to interact with the community. We did an event such as this, a live event, back in May with many of the same people who are here today to just let the community know what was going on with regard to the opioid overdose crisis. I also want to thank the Board of Commissioners for your support, not just through COVID, not just through the opioid overdose crisis, but this board, as well as previous boards of commissioners, their support with regard to addressing substance use issues and supporting recovery and prevention and various other substance use related issues. And thank you for that. And I always like to make the comment, it's through the support, our local support that we have here, that we were able to have a infrastructure in place, which helped us as this opioid overdose crisis hit us, that we had a lot of pieces in place. It could have been a lot worse in Berks, and not that it was good, but it could have been a lot worse. And thank you, commissioners, for your ongoing support, and not just in terms of providing funding and resources, but also in terms of your quote unquote moral support. I know when we have our recovery day with the commissioners, that's a meeting that you all look forward to. Hopefully, if not this year, next year, we can be there live with you again, just to show the community and those folks who are in recovery that local government really supports them and wishes them to be back to being productive citizens and contributing citizens in our community. So thank you for that. Several years ago, we noticed at the Council on Chemical Abuse, and again, the Council on Chemical Abuse is a single county authority for drug and alcohol issues in Berks County. And through that, we get various government funds to help support prevention efforts, intervention efforts, provide a safety net for treatment for those folks who have no kind of health insurance to get to treatment, as well as supporting recovery in the community. What we noticed, at least through our funding, was that there was a significant increase in the number of people who were accessing treatment because of opioids, including heroin. Significant. We went from about 20 to 25% to well over 40% of the folks that we funded for treatment that had that as their primary drug of choice. It was around that time that we also noticed more overdose deaths that were occurring, and we needed to up our efforts. However, the crisis that hit us, this overdose crisis that hit us, is not strictly a drug and alcohol issue. It's a criminal justice issue. It's a law enforcement issue. It's a health issue. It's a social issue. It's a family issue, and it's nothing that COCA on its own, or agencies like COCA on their own, is going to address and put an end to, if you will. And we'll talk a little bit more about that. I was hoping today that what we'd be able to do is give an overview of what the issue is. I would imagine that most people understand the nature of the opioid and the overdose crisis that has swept the nation, swept Pennsylvania, and not left Berks unharmed through this. And then after that, we can talk a little bit about some of the efforts that we did locally in collaboration and as entities, various entities here in organizations to address the issue. And then the last thing we'd like to address, and hopefully we have enough time to do all this, is how COVID has affected this. So as we look at an overview of what the problem is, we have three individuals sitting here: the district attorney, the coroner, and a physician, Dr. William Santoro, who are on the front lines of this and know this quite well. And as opposed to me spurting out statistics, I'm going to let them talk a little bit from their perspective. So I'd first ask Coroner John Hollenbach if he could kind of give us a little bit of an overview in terms of what we were seeing in terms of rise in overdose deaths and just kind of give us a backdrop of those kind of things. So John, thank you for being with us here today, and I'll turn it over to you.
Good afternoon, everyone. Thank you, Stan. Looking back, for this presentation, I went back to 2016 and gathered up our data. And what we saw was in 2016, we had 118 confirmed drug deaths, and 54 of those involved fentanyl, which equated to about 46% of the deaths involving fentanyl. In 2017, we went up to we went down to 116 confirmed deaths, but 86 of those involved fentanyl, which equated to about 75%. 2018, we had a significant decline in drug deaths, and we went down to 95 confirmed cases. But again, that was 69 of those involved fentanyl, which equated to 73%. In 2019, we went back up to 126 confirmed cases, which at that time was the highest Berks County had ever seen. 86 of those involved fentanyl, and that equates to 68%. And what we had seen in those years, we saw a decline in heroin. From 2015 and 16, when heroin was more prevalent and fentanyl started coming into it, the numbers of deaths that involved heroin alone without fentanyl being mixed in it significantly dropped into single digits. And then in 2020, we unfortunately went up to 130 confirmed drug deaths and had 101 involve fentanyl, and that equates to 78%. And there were absolutely 0 deaths that had heroin alone. All of the deaths in 2020 that involved heroin also had fentanyl in it. And then in 2021 so far, we're at 20 confirmed drug deaths, 14 involve fentanyl so far this year, which is 75%. We have 11 cases that are pending toxicology results. A couple of the figures I wanted to put out is from 2016 to now, we have had over 600 drug deaths. From 2010 to 15, we had slightly more than 300 drug deaths. So we have almost doubled the drug deaths in the last 5 years. Our office, when we deal with deaths, most of what we deal with are natural deaths. Drug deaths are the second leading type of case that we investigate. What I put together was from the last 5 years plus, the youngest death that was due to an illicit drug was an 18-year-old, and the oldest was a 74-year-old. Unfortunately, when it comes to some prescription drugs, we've had younger deaths and we've had older deaths. And the last thing I want to put out statistically is I hear this a lot, that the drug problem is a Reading problem. I'm here to tell you that that is wrong. It's a Berks County problem. Reading, unfortunately, has the majority or most drug deaths because they have the biggest population. In Berks County, there are 72 municipalities, boroughs, townships, and the city of Reading. Drug deaths have occurred in all but 7 municipalities. So it is all over the county. It does hit every age group. It does hit every socioeconomic group. There is no one that can be untouched from the drug epidemic.
Thank you, John. And I just want to say, while we're here publicly, thank you and your predecessor, Denny Hess. Without fail, at the beginning of the month, we have statistics for the month before. So we're working in real time with regard to understanding the nature and the extent of the issue here. And I know my counterparts across the state are envious of me because we have access to that information, because it's always not that available in other counties. So thank you for all you do and how you help us out. Next, I'm going to ask John Adams to talk a little bit about the crime associated and some of the law enforcement efforts with regard to the opioid overdose situation. And I also got to point out that District Attorney John Adams several years ago coined the phrase, "We're not going to arrest our way out of this problem." And he understood that law enforcement can do their interdiction and make their arrests and do all the things that we've come to know and expect from law enforcement, but it's not going to get rid of an addiction problem in the community. It's not going to wipe away the overdose issue. It's part of the solution in terms of doing that. But he also puts a lot of emphasis on giving folks necessary help as needed and as appropriate, depending on what their charges are and where they are in the criminal justice system. So now I'm just going to turn this over to District Attorney John Adams so he can give us a perspective from a law enforcement point of view. John?
Good afternoon, and thank you for having me on this program. I think everybody should understand that all of the individuals here, including all of our commissioners, deeply care about this issue and its effect on our community. And we have all invested a lot of time, money, and labor into combating this issue. You know, a lot of the crime that we see in our community, in the county, in the city, it's really, a lot of it is fueled by the crisis of drugs, and especially the opioid crisis. You know, be it a retail theft, the people who are generally committing retail thefts, they're driven to do that because of addiction. Other crimes that we see all the time are driven again by addiction. We'll arrest individuals that may be involved with burglaries, robberies, spree crimes of trying to break into motor vehicles, to steal a credit card, to steal money, pocketbooks. You know, why does that happen? Well, it happens because the majority of the individuals who are committing these crimes have an underlying problem, and that generally that underlying problem is addiction. We recognize that, and like Stan said, that I've said for years, we're not going to arrest our way out of this problem. Yes, some of the individuals who commit some of these crimes end up incarcerated, some for a substantial period of time, depending on the crimes that they commit. But as part of, you know, we're looking to get people involved in treatment, to participate in treatment, to get the help that they need so they can turn their lives around. But we will see for, you know, for the time being, a lot of the crime that occurs in our community is driven by the opioids and the addiction to opioids. Opioids are very addictive in comparison to some other drugs. And because of that, these individuals who are addicted need money to go buy their drugs, to get their high, and they will commit crimes that affect all of us daily. Even if you don't have anyone in your family that may have a problem with drugs and alcohol, there's problems right around the corner if someone commits a crime fueled by an addiction. I'll turn it back over to you, Stan.
Thank you, John. I was unmuting myself. It seems to take me a while to do that. But thank you, and thank you for all you do, and thank you for the collaboration that we have between our agency, our task force, and your office. We've done a lot of good things together, and we'll point those out a little bit later. Next, I'm going to introduce Dr. William Santoro, and we're fortunate that not only is he with us here today, but that he's here in Berks County. He's an addictionologist. He's an expert in addiction, and not just a Johnny-come-lately over the past year or two. He's been involved with this for a long time, and he's been involved with medication-assisted treatment, which is one of the most effective ways of dealing with someone who has an opioid use disorder for decades. And I think that's where I met him at the methadone clinic years and years ago. But he's on the front lines of not just treating individuals, but seeing some of the health impacts that occur because of this. So I'm going to turn it over to Dr. Santoro and let him give us share some insight with us around this. Dr. Santoro.
Thank you, Stan. I want to say that the numbers that John Hollenbach had presented don't surprise me. We had started to see some numbers improving. I always try to stay away from the phrases like a war on drugs. This is not something we're going to win, ever. This is something we're going to try to control. But the numbers were improving, and then the pandemic hit. And in order to control things with the pandemic, we told people to isolate. And for years, those of us in the field of addiction have known that isolation is actually a risk factor for addiction. So it's no surprise that as we told people to isolate, people with addiction worsened in their field. And then you add in and make it a perfect storm. You've mentioned, again, John Hollenbach had mentioned about how much fentanyl has increased. Fentanyl has taken over the market. It's mixed with everything. And when I get patients and they say, but I'm not using fentanyl, and they're positive for fentanyl, and they say, but I'm using cocaine, or I smoke marijuana. What we have to realize is that these people who are putting these drugs on the street need better quality control. They don't have a quality control team. They wipe off the counter and dump the next set of drugs on the counter, on the same counter, and things get contaminated. Drug dealers are not purposely, I don't believe, purposely mixing cocaine and fentanyl together. They would rather sell them separate. They're not giving you a 2-for-1. They're going to sell it to you individually, but it does get contaminated. We have seen fentanyl contaminated with cocaine, amphetamines. We've even seen in certain, not here, thankfully, but we have seen in other parts of the country, fentanyl contaminating marijuana even. So these numbers have worsened. What have we done about it? A couple of things. Locally, we're trying to increase the access to care. Here at Telehealth, we've made it a goal that if a patient calls here and wants an appointment, our goal is to get them that appointment and be seen face-to-face within 24 hours. We can't always do that if a patient calls up on a Friday afternoon, but then the goal is to give them an appointment Monday morning. We've partnered with different organizations, the Warm Handoff. The Warm Handoff works through the local emergency rooms. They actually have contact. They have the ability to contact and get into my personal schedule, so that if they see a patient at 3 in the morning, Thankfully, they don't have to call me at 3 in the morning. They can go into my schedule and see that I have an opening at 10 a.m. and they can give that patient the appointment and write it into my schedule through the computer so that I'm ready to see that patient 8 hours after they have. We've also increased access by doing telehealth. The telehealth has helped. We have not gone to the point of initiating a patient on medication-assisted treatment through telehealth, but we have continued them on it. This has saved people from having to come all the way into the office when there should be isolating. I took care of a patient through telehealth who was actually tested positive for COVID and was able to still make her appointment by coming on through telehealth. We've partnered with a program called the Soft Landing that takes care of, we have a program that takes care of pregnant women, and the Soft Landing is taking care of the babies that are born then subsequently addicted to drugs. We have a hub and spoke model program that was initiated through a PACMAT grant through Pennsylvania. And this is set up where we can take care of patients here at we're the hub. We have 3 providers, myself and my 2 partners. We can get patients stabilized on their medication. And then one of the problems that patients have is that in our field is that they typically don't have a family doctor. We have partnered with about 14 family physicians through multiple, not just in Berks County, but we've actually spread it out into several other counties that Tower Health is involved with, that we can then take care of the patient here, and when they're stabilized, transfer them to their family doctor who can continue the medication-assisted treatment. We have made it a little bit different than the standard hub and spoke in that we don't discharge the patient. The patient is still a patient here at the hub. So if they have a problem with the physician that we have sent them to, the patient knows they are still a patient. In this office, they can pick up the phone and get an appointment with any of us as if they were just seen last month. The physicians that are part of the spoke also know that they can pick up the phone and call us and say they have a problem with the patient, and they can get that patient right back in here. The key is that we all need to have communication and that we have to be readily available to help the patient when they need it. With these things, I think that we have improved the access to treatment here in Berks County. I'm hoping that as the pandemic gets under control, when we get back to a more normal, a more new normal society, that we can pick up where we left off and continue with the strides that we've made in the past through places like Berks SOS. And with that, Stan, I'll turn it back to you.
Thanks so much, Dr. Santoro. So it became evident, not just for those of us who work in the drug and alcohol field, or those that the coroner's office or healthcare professionals or law enforcement, that there was an issue going on. Many aspects of society, families were feeling this, schools were feeling this, and there needed to be some kind of response to this. Back in 2016, at the behest of the Criminal Justice Advisory Board and the commissioners, a opioid task force was put together, and they came together, and it was many different stakeholders from within the community, both within government, within social service and healthcare organizations, law enforcement, private citizens, and they came together to say, we need to do something about this. And a strategic plan was developed, as Commissioner Barnhart mentioned earlier, with the technical assistance help of University of Pittsburgh, Pitt, Peru. They have been kind of helping us and guiding us through this process. And something needed to be done. And I know from our end at COCA, we saw more demand for treatment. And we also realized that there was a need to get Narcan to be available in the community. And we started doing those kind of things, buying Narcan kits and making them available. And any Berks County resident who wanted Narcan could come to us and get it. And Narcan is not a panacea, is not something that is going to treat addiction or erase addiction. What Narcan does is it saves the life of somebody who has overdosed on an opioid, period. From our perspective, and I'm sure everyone's perspective, you can't get somebody better unless you keep them alive. So the use of Narcan and the availability of Narcan was important to us. And what we have come to learn is that the more Narcan we can make available, the more lives we can save. And I remember several years ago, back probably 2015 or 2016, and I'm going to turn this over to the district attorney again. Some medication drop boxes were put in place. The district attorney took this on as an issue with my predecessor, and John, maybe you can explain a little bit about the medication drop boxes.
Yes, thanks, Dan. Yeah, the medication drop boxes were installed, and I hate to say this, I don't recall the year that we started it, but we started it a number of years ago. I'm going to say about 5 years ago. It was a collaboration project between the Council on Chemical Abuse, my office, and also the Berks County Solid Waste Authority, because not only do we want to dispose of unused drugs, we want to dispose of them in a manner that will not pollute our water system. We don't want to flush them down the toilet. So these medication drop boxes are now located throughout the county. We have 30 locations throughout the county where they are located. They are generally in police departments throughout the county, and we have 34 boxes. So they are very accessible. They are in all parts of the county. Check with your local police department. It is a safe place to get rid of your drugs, your unused, be it opioids or other prescription drugs, which should not be flushed down the toilet. So it's a great avenue. And, you know, we have disposed, since we started this project, and we started the project in 2013, I apologize, we've disposed of 62,000 pounds of controlled substances. That's a lot. And I'm very proud of this program, and it was a great team effort to get it up and running, and frankly, to see that it continues to thrive today. But we'll talk later about the effect of COVID on this specific project.
Yeah, thank you, John. And I know that the medication drop boxes, you say that's a lot of pills that are put in those boxes. And I know personally I've dropped some things off there, and it's very easy to do. There are police stations. Nobody asks you a question. No one wants to know what it is. You just drop it in, and you know that it's going to be disposed of safely, because like the district attorney said, we don't want to flush this down the toilet or wash them down the sink. It's not good for our environment. And what we really don't want to do is keep these medicines in our medicine cabinet, where they can get into the hands of folks that really shouldn't be touching these things, whether it's our kids, our grandkids, our neighbors, whatever. In fact, we've heard through, and I know Commissioner Barnhart heard this too, through our SOS Berks discussions, that even realtors know that, you know, sometimes you got to tell folks, put your medications away if your house is for sale and you're showing your house, because you never know if someone's going to root through your medicine cabinet and take some of the medicines you have there. So that's kind of where we're at. So it's important that we have these medication drop boxes, and yearly the Berks County Medical Society has a medication drop off, and this year they're doing it again. It's April, I'm going to do the commercial here, April 17th between 10 a.m. and 2 p.m. at First Energy Stadium. You show up there, you drive up, they're going to take your medicines from you, and you drive away. Very simple and a very effective way of just getting rid of your medicines. We also know that not always everyone can get to a medication drop box or get to a disposal day, if you will, especially some of our shut-ins. And we, with working with the county and the county mental health department, we purchased a bunch of medication disposal bags where someone can get their medication, put it in a bag, add a little bit of hot water, and a little science experiment happened there, and it gets rid of your drugs very safely, and you can just throw the bag away. So we have those available, and this was a collaborative effort through SOS Berks, and we have those available here at the Council on Chemical Abuse. Some of the other things we did to try to address this is we know there were a lot of folks that would go to the emergency room because of a drug overdose, and the emergency department would treat them, medically clear them, and then they would leave, and you know, sometimes they would show up again within days or within weeks or within months or whatever, and there was no kind of collaborative effort to kind of deal with this, and we worked with specifically Reading Hospital. We also worked with St. Joe's Hospital, and Dr. Barbera, who was in charge of emergency services at Reading Hospital at that time, helped us to develop a warm handoff program. It started out as an on-call program, and then it went to a 24/7 service, which is collaboratively funded between Reading Hospital, COCA, our Medicaid managed care partner. And what happens is if someone goes to the emergency room because of a drug overdose, or they have an opioid problem and they show up at the emergency room because they're experiencing withdrawal symptoms, or they show up at the emergency room with some other type of substance use disorder, and they need care there. As soon as they're medically cleared, we have a certified recovery specialist who will help do an intervention and get them to appropriate care. Dr. Santoro mentioned earlier that they have immediate access to his schedule to schedule something the next day. So as they say, you've got to strike while the iron's hot lots of times, and getting folks into treatment. And this program has grown significantly over the years, and where we were treating, I'm looking for the paper in front of me here, as while we were treating maybe 50, 60 people the first year or two, now it's well over 1,000, even last year with COVID. And we had to slow down the operation at the emergency room, and people weren't going to the emergency room. It cleared over 1,000 people that we were able to intervene upon at the warm handoff program at Reading Hospital. So that was a collaborative effort of the SOS Berks, the Opioid Coalition, that helped, really made a difference in the community, because these are folks now that normally would have been seen and then back out in the community, and then they may not have been as lucky the next time they had an overdose, and we're reaping the benefits of that. Another program that was a collaborative effort between SOS Berks and specifically with the District Attorney's Office was what we call the Blue Cares program. The Blue Cares program is a program where if law enforcement is involved in an overdose save, which happens a lot, then a police officer and a certified recovery specialist will visit that person within a day or two, not for any type of legal ramifications for this, but show up and say, we're concerned what happened to you. We're glad you're still alive. We don't want to see anything bad happen to you, and let us try to get you some help. This is really an example of law enforcement between the District Attorney's Office and the Police Chiefs Association locally. They embrace this idea, and we've taken off with this. And I'm actually going to ask Yvonne Stroman from our office, who has been very much involved with it, to discuss this a little bit. So Yvonne, if you would, please.
Well, thank you, Stan, and good afternoon to everyone. Yeah, the Blue Cares initiative, we really can't say enough about the District Attorney's Office as well as our local law enforcement, who really helped partner this initiative that really sought through getting individuals treatment versus locking them up. And so upon the initial overdose, if they are saved by a police officer, we're then contacted to go to that local district where the individual experienced the overdose, in tow with a naloxone kit, as well as law enforcement, to knock on the door to say, First of all, we're glad that you're okay and that nothing tragic happened to you, but we also like to afford you the opportunity to get access to treatment. And by that meaning, we want to share with you the opportunity to go to the TASC, which is our local central intake unit that provides drug and alcohol assessments, and then to determine the level of care, which would then allow you to get access to treatment. And by and large, this way, individuals are getting the help that they need versus, feeling as though they have to, hold in their secret of using behind closed doors. If the individual is not home for some reason, then we also have the opportunity to speak with the family members as well. And so what we can do with the families is let them know that there is information available, there's help available, not only for their loved one, but for the families as well also. And we leave that information behind for families also, just to let them know that their loved one can get help, but the family can get help also. It has been my joy to see the relief on family members' face. We talk about, substance use disorder being an isolated disease, but for many people, for many families, it could be one of shame, and folks are not readily coming forward. And this really shines the light on the need for help, the need for support, and let families know that they can get well and heal through this process. So Blue Cares is really one that has been very much so a welcome to the community, a support for the community, more importantly, support for family and loved ones to get the treatment and the help that they need.
So thank you, Yvonne. And lots of times, not just with the opioid crisis and overdose crisis, but with substance use disorder, the family members are kind of like the forgotten victims here. They're as much a victim to the disease of addiction as is the person with the addiction. And the more we can do for families to help them cope with this, because not all addiction ends up with people in recovery. There's folks that end up in an institution somewhere or end up dead, quite honestly, and families need help. So for every person that has a substance use disorder, there's a cadre of family, friends, loved ones that are around them that are being affected by this and being affected strongly by this. So thank you. And just before we move on, just to mention the Blue Cares, this has been so successful in terms of interacting with law enforcement. We've been working with the district attorney on what we're calling the Blue Cares Next Step to look at some law enforcement diversion for some of those crimes the district attorney mentioned before, some of those quote unquote minor crimes, if you will, and looking at ways for the district attorney's office to help us intervene before it goes through the court system. So it saves people going through the court system and getting them the help that they need. And if they don't participate and don't follow through with the things they need to do, then the full weight of the criminal justice system can kind of bear down on them. We know in the field of substance use disorders that the criminal justice system is a great motivator for people to go get help. And a lot of people who are in long-term recovery from an addiction or some type of substance use disorder got to where they are now because of some type of criminal involvement in the courts, kind of leaning on them and helping lend some motivation towards getting better, and whatever it takes as far as we're concerned, because we know the ravages of substance use disorder. So I know we could talk about these subjects for quite some time, so I just like to move on to the next part here and how COVID has affected what's going on. And I can just, before I turn this over back to John and to the coroner and to Dr. Santoro, to say that I know from when COVID hit, things like rehabs, if you will, residential treatment programs were affected immediately. It was really hard to put 2-3 people in a shared room with the scare of COVID and who has COVID. And if we can go back that one short year ago, testing wasn't as available as it is now, and knowing who had the virus and how to deal with it. So it did affect capacity issues with regard to residential. Now, they've come back somewhat, although there have been several across the state. Many programs have been negatively affected by COVID and the financial impact of that, and a lot of places have closed their doors since then. One of the places is our beloved Drug and Alcohol Center that the Reading Hospital ran for years, and I know Dr. Santoro has a soft spot in his heart there because he did work there, and it was our local quote-unquote detox that people could just walk to, right there in West Reading, and They closed their door. They were a casualty of COVID. And as Dr. Santoro was mentioning earlier, there is a lot of virtual kind of outpatient care that's happening now. And it was a godsend in terms of it was there and it was better than nothing. And we're still working our way through some of those issues. And what does this mean? And how does getting counseling or treatment remotely really work? So with that, I'm just going to turn this over back to the district attorney, because you did mention that the COVID did have an effect on what we're doing here.
Yeah, COVID did affect everything, as we all know, and we've learned immensely. I'll just start first with our medication drop boxes. We saw a 32% decrease in the amount of in the pounds of controlled substances that were collected in the medication drop boxes. We did see a drop off in the number of criminal cases that are in our court system. But again, I think that was really effective by the lack of police response to some things. People were hibernating at home, but they were still using drugs. And we saw that effect in the fact that our overdoses increased. Frankly, from the fact, when I look at the statistics, our arrests in our felony drug arrests in 2019 compared to 2020, yes, they did drop in 2020. However, we still totally in the criminal cases that were initiated increased in 2020. I have to say this in defense of my detective unit. Despite COVID, we didn't stop enforcing the law, and we were out there seizing drugs, executing search warrants. Yes, there were a month or two that we had to slow it down, but then we got back out because we realized there's a problem and we got to continue to attack it. And we did do that. We did see, and we're going to always see increases and decreases in the amount of drugs that were seized during our enforcement efforts. And that did take place again, but it's almost like a case-by-case basis, because while we saw some incredible, I will call incredible decreases, it may be because we didn't hit the big case. But I will tell you that fentanyl, we talked a lot about fentanyl, and we confiscated in 2019 about over 7.5 kilos of fentanyl in the county. And fentanyl, I've described it as a denominator of death. Now in 2020, we confiscated about 1.5 kilos of fentanyl. It's amazing when I look at our statistics. We can have years where we confiscate huge amounts of, I don't call it an opioid, but methamphetamine. And what we're seeing now in many of our overdose deaths, fentanyl is being mixed with methamphetamine, resulting in deaths. And in 2019, we confiscated almost 42 kilos of methamphetamine. Now that number had dropped drastically, but the amount of heroin that we seized in 2020 was actually over 5 kilos of heroin. So we're seeing heroin's here, fentanyl's here in our community, methamphetamine. Those are the three drugs that really we're seeing a big problem with in our community. We're seizing a lot of it. We're enforcing constantly, in participating in enforcement efforts when it comes to these three drugs. And we're not going to slow down, and we're not going to stop, because if we would, the crisis that we see would just multiply and result in a lot of people's losing their life. And an increase in crime in our community. So we're going to keep up, trust me, we're going to keep up our enforcement efforts, but we also want to help people. Treatment is important.
Thank you, John. John Hollenbach, I know you had kind of mentioned it before. Do you want to put like an emphasis on that in terms of the fentanyl and what you're seeing in your office?
Well, just to repeat what John said, if it wasn't for fentanyl, the number of deaths would be significantly less. What we've seen over the years is heroin was, 5, 6, 7 years ago was a predominant death, or drug involving death. Now we're seeing heroin not so much. Like John said, we are seeing more and more deaths involving methamphetamine, some of it mixed with fentanyl, but our meth alone deaths have significantly increased compared to what they were a number of years ago. One of the other things that we see quite frequently in Berks County is a substance called Xylazine. And that is a animal tranquilizer. And we see that quite often being mixed with drugs in our toxicology reports. I've heard from some of the other counties around us, they don't see that as often, but I think that's a lab issue that does testing. The lab that we use here in Berks County, they do test for that, and that is coming up more and more frequently. So one of the biggest things is that I always say is the illicit drug trade is Russian roulette. The people might go out thinking they're purchasing heroin or purchasing meth or purchasing cocaine, but they really don't know what they're getting. And with the number of deaths that are happening and they're increasing, I just, until something happens with fentanyl, I just think our numbers are going to keep going up because it's getting mixed with everything.
Thank you, John. And I think the key point there is people purchasing some type of substance illicitly or illegally on the streets. You don't know what you're getting. It's not prepackaged, and there's no kind of ingredients on the side, what's in there and how much of this or that that's there. Like you say, it's Russian roulette, literally. So thank you for that. Dr. Santoro, maybe you can kind of bring us to, like, especially with medication-assisted treatment and how that worked during COVID and people quarantining and what did you see there?
Yeah, and you guys all know me, so you know I'm about to meander all over the place. I consider every person on this panel with me a friend, and you guys have known that in past times I have this little game that I play where I count up the number of times people use certain words that I don't agree with. I have to say, I'm not going to say what the word, well, maybe I should say what the word is so the viewers understand. Nobody here today has used the word addict. Addict is a noun. It does not describe my patients. It is as offensive to me as if somebody walked in the room and I said, Stan, let me introduce you to a friend of mine. He is cancer. You would tell me that that is inappropriate. He is not the disease. He has cancer. And I'm happy to say that today's count was 0 in the use of the word addict. As far as medication-assisted treatment, I'll give you guys a warning. That's my next word that I'm attacking. It's not medication-assisted treatment, it's medication treatment. Years ago, I would be arguing against people whether it was MAT versus abstinence-based, and I was trying to tell them MAT is abstinence because we are trying to be abstinent from illicit drug use. And being on medication is not the same as being on an illicit drug. So when we treat people with diabetes, we don't tell them it's insulin-assisted treatment. When we send a person to counseling for drug and alcohol, we don't say it's counseling-assisted treatment, it's counseling treatment, it's insulin treatment. Well, frankly, it is medication treatment. We need to get it where it's not us versus them. It is all of us together. Medication, counseling, social treatment, social connections, spiritual connections. They're all one. They're all treatments. As far as now, I'll come back off my soapbox and answer your question, Stan. How has COVID affected it? It's been horrible. We have had more treatment, more patients who need treatment. Yes, I was the medical director for the Drug and Alcohol Center for 31 years. I had been going there every day. If I was in the country, I was in the drug and alcohol unit for the past 31 years. And I am sad to say it is now not with us. And that'll be a topic for another day, but we have had to adjust with the reality that it is not here, and we're dealing with it. COVID has worsened the crisis, and we don't have the DAC to turn to, so we have to turn elsewhere. I think that we have done the best we can, given the circumstances of the isolation of the pandemic, that we have continued to treat patients safely here in our office, with lots of precautions and taking care to wipe things down in between patients and get patients in who need to be seen. So we have increased our telehealth visits. I think that I try to look for the positive in any of this, and trust me, COVID has really tested my patience in trying to find anything positive. But if there is, I don't think that telehealth is going to, nor should it, disappear. I think it needs to be mixed in as an integral part of our treatment and accepted the same way I have accepted other philosophies such as abstinence-based and AA and NA, along with medication treatment. They all need to be together. I think telehealth needs to be a part of that. I know that we've identified certain visits that were very high no-show rates. We turned those visits into telehealth visits, and the no-show rate for a telehealth visit plummeted. So we're planning on making those particular visits standard to be telehealth visits. That will increase our seeing the patients, even if it is on a computer. We'll be able to see and take care of that patient, which is certainly better than just wondering how they're doing. And then they mix it back in. It's not all telehealth, but it's not all live. And I think that is an appropriate way to do things. We're getting pushback on some of those ideas by the insurance companies because they're not ready to necessarily cover the cost of a telehealth visit. I think we're going to need help from our politicians to push on the insurance companies to say, this is appropriate. We have the evidence that it is good medical care and that it is beneficial to the patient, and therefore they should cover the cost of it. I think we have to then expand that and look at the problems with it. The barriers that exist, there are certain people who are involved in or affected by COVID don't have access to computers, don't have access to cell phones or the knowledge to do a telehealth visit. So I think we have to look at the social determinants and figure out who it's being adversely affected and how can we address that. It's going to be our inner city, which you've said there are more people there, therefore there are more deaths there. It's going to be persons of color, minorities, women, pregnant women. These are the social determinants that we have to look at and say, we can attack these barriers if we do it in an intelligent fashion. So I have some reason for optimism in this bleak time when I read that COVID is increasing and we're looking at a next surge, including here in Berks County. I still think that there are certain positive things that we have learned over the past year that we can institute and move forward to improve. Stan, I'll turn it back over to you.
Thank you, Dr. Santoro. And I know we're running out of time, commissioners, and I really apologize that we've kind of, gone this long, but I'd be remiss if I didn't turn this back over to Yvonne just for a minute or two, because the biggest part of someone getting better from an addiction is treatment's one thing, but it's recovery and sustaining recovery. And COVID has had a major impact on that. And if I could hand it over to Yvonne for a brief minute or two, just to kind of say, how has this impacted recovery efforts?
Stan, you're doing fine on time. Don't worry about it.
Okay, thank you.
Yes, thank you. Thank you, Stan, for the question. So what we know is that mutual aid and 12-step help groups, like Dr. Santoro alluded to, Alcoholics Anonymous, Narcotics Anonymous, were a place of providing folks with support and encouragement to help individuals change their quality of life. And that includes freedom from the bondage of addiction, as Dr. Santoro so eloquently put it. And what happened with COVID-19 when that came on and entered into our communities, the purposes of physical meetings, safety meetings were put on hold. People were not able to gather as they once could in a safe environment. And so what happened was we needed to go virtually. And so those meetings where folks once met in person had to go virtually. And it was the next best thing because it was something versus nothing. And we know the value when people can get together and support one another, how that can be the difference between someone picking up their next drink or drug and really not, and really being able to abstain from that. So the virtual meetings really did provide a venue where folks could at least meet, could at least continue to share what their challenges were, what their celebrations were, but to do so in a way that they got that support. And so what we experienced was, as time went on and things got a little bit better through people being inoculated with the vaccine, that there have been some hybrid in terms of folks meeting in person a little bit, so long as social distancing was able to be acknowledged. But as Dr. Santoro indicated, as we continue to see this upsurge, we know that meetings then had to back off a little bit. And so we have to recognize the need for that ongoing support. And thankfully in our community, there's been a great push among the 12-step and mutual aid supports to really take a look at what's happening in our community and how do we adjust that so people are still able to get the support that they need.
Thank you, Yvonne. And beyond just, I know over the past several years, we've embracing more the concept of many pathways to recovery. And it may be a 12-step fellowship program, or it may not be. It may be a secular program. It might be a religious-based program, whatever it takes for someone to maintain their recovery from an addiction is important, and it doesn't really matter. There's no right recovery path. It's a very individualized matter for people, and we know that the people that got hurt the most are those folks new to recovery, who were used to going, whether it would be to some kind of religious church or synagogue where they could get some support there, or whether it be a 12-step fellowship meeting, or whether it be a SMART recovery meeting or a Dharma recovery meeting, whatever the case may be. There's many pathways that they weren't able to go, and it really affected them. Those folks who had many years of recovery under their belt, they had the resources and the phone numbers and those ways of maintaining and staying in recovery. And those folks that were new to this, it was much more challenging for them. And we know that those folks that are coming out of treatment and may have a little bit of sobriety under their belt, they're at a higher risk for overdose if they use opioids. So getting them into a recovery program, getting someone into a recovery program and making it available is crucial. Treatment's crucial, but recovery supports in the community are crucial. And so we're hoping, as we come out of the fog of COVID, if you will, that these things will start to kind of flourish again, and folks can kind of get what they need. So Commissioner Barnhart, thank you for the time. I know we've gone over our hour, and I know you said it wasn't a problem, but there's much more things we could discuss here. We just kind of touched on some things, and I really want to thank Coroner John Hollenbach, Dr. Santoro, and District Attorney John Adams, as well as Yvonne Stroman from our office for joining us here today and kind of lending their expert opinion in terms of what's going on with regard to the overdose crisis. So thank you.
Doesn't mean we won't invite you back somewhere in the future. It was a great dialogue. If any of the panelists have any closing comments they weren't able to make, feel free to do so now. If not, we'll move on to our questions. And we also will put up a slide, if Heather can put up a slide about the medication take-back event. So anyone on the panel seemed to have missed anything? I think it was a well-rounded hour and covered a lot of territory.
So the only thing that I'd like to throw out there, and I don't have a graphic for it, is the Council on Chemical Abuse website, www.cocaberks.org. We have a lot of resources there. We have links to SOS Berks sites, as well as a lot of different resources with regard to prevention education materials, as well as treatment resources and recovery resources in the community. So I encourage those folks, since we couldn't cover everything today, to visit our website and call us and ask us questions, or email us and ask us questions. That's what we're here for. So thank you for the opportunity.
You're most welcome. Anyone else?
Let me just mention also at the Council on Chemical Abuse, we do have free Narcan kits. And so if individuals are interested, you just have to be a Berks County resident to get one. We are more than happy to make sure that you are safely given a naloxone kit for your home.
And confidentially, and we don't track who's taking them other than to know when the expiration date is, so we can say, hey, you're expired, and here's another one. And to that point, we need to do we need to strategize about how to get this into the various parts of our community. We make it available, but there's parts of our community that's still not taking advantage of it, and we're looking to up our efforts around that. So
good information. Bill, John. Okay.
The only thing I want to add, just to touch on the prescription take-back boxes or drop-off boxes. We do have one at the coroner's office. We use one for when we go out to a scene with the decedent, we collect their medications. We've had other family members give us theirs. And we also have the public stop by the office. So it's not just police departments, it's also available at our office as well.
Yeah, that's a good point, John, as well as there's several pharmacies that now have put medication drop boxes within the pharmacy. So you can go to the COCA website. We have a list of various places you can go to. So thank you for that.
And I'll be very brief, but I would like to say to anyone who is listening, if you know someone who needs help, push them to get the help that they need before handcuffs are put on them and help gets tougher, because we really want people to seek help on their own, and we want them to seek help before there's what I would call criminal justice intervention. But we're here to help people.
Well said, John, well said. So we have on the screen right now the 5th annual prescription drug take-back event, which is Saturday, April 17th, 10 a.m. to 2 p.m. at First Energy Stadium. It's a drive up and turn in unused or expired medications for safe disposal. As John Adams alluded to earlier in the program, 62,000 pounds, John?
Yes.
62,000 pounds have been turned in. Let's keep those numbers going. A lot of unused and expired medication out there in our community yet. We have 2 questions on Facebook. Jesse would like to refer to this. I think we answered the first one, but if you would like to read it, that's fine as well.
Sure, I'll read both comments.
Thank you.
From Facebook. The first one is from Barbara Heckman Olwe. Please add those dates and places for the medical drop box. And the second comment is from Allison Paulez, a psychologist here. This is an appropriate way to expand upon accessibility and provide meaningful care if and when considering those social, practical, and clinical factors.
Okay. I think the second one was more of a statement than a question, I believe.
Sounds like just a comment.
Yes, good. Well, that's great. And again, I want to thank our panelists. I know you're all busy people, but it's critically important for us to continue to push the message out about the impact on overdoses and opioids, specifically in our community during through COVID-19 and beyond. And part of SOS Berks began as the overdose of opioids, but it actually morphed into about 2 years ago, each and every substance use disorder. So we do cover each and every substance use disorder at our meetings. Again, if you're interested in joining SOS Berks, please reach out to Coca or myself here in the Commissioner's office. We'd be happy to have you join us. Right now, we are still virtual, but we have 6 committees, and I'm sure we can find meaningful support for you and by you to join us in this effort to combat overdoses in our community. So I want to thank our panelists, Stanley Papademetrio, John Adams, John Hollenbach, Dr. Bill Santoro, and Yvonne Stroman. And this concludes our media program for Wednesday. Thank you and enjoy your evenings. Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you, everyone.